Hi, I'm Dr. Teresa Roca, and I'm a pediatric cardiologist with Diagnostic and Medical Clinic. My specialty, as I said, is pediatric cardiology, and this is very important this month because it is American Heart Month. Heart disease is one of the leading causes of death in adult and children, and with our current culture of increased obesity, decreased activity, all of these things have raised the incidence of heart disease, not only in adults, but even very young children. Heart disease has come a long way in children born with heart defects. Actually, the survival of these children has improved dramatically, yet at the same time now we're seeing more children developing adult onset of heart disease, things such as hypertension, diabetes. And because of this, it is very important that we raise the awareness to improve activity in children and adults so that we can improve the survival of all. Heart disease affects about 1 in every 100 births in children. It can be a very trivial defect, small hole, or something extremely complicated where literally half the heart does not develop. In those children, we don't actually repair their hearts. We do something called palliation, where we make their hearts functional, and most of these children will probably eventually have to have heart transplants as an adult. That is why an organization like the American Heart Association is so important, because they have made these children survive. Many of them now are reaching adulthood, leading very normal lives, and it is clearly because of the advancements in medicine. As I said though, most children have very, very minor defects, and actually many of these children will outgrow their defects and never require surgery. Prevention, of course, is key when we consider all the aspects of heart disease that we see in adults, and it should start young. That is very difficult in this culture where we have computers, televisions, and we're just not very active. It is important first to know your family history. Unfortunately, some people have greater risk factors simply because of the genes that they are born with. Knowing your family history is crucial. Number 2, teaching your children and taking on good dietary habits very early on in life make a huge impact later on. Studies have clearly shown that children who have good diets when they're young have lesser incidence of heart disease, high blood pressure, diabetes, and all of the problems that we see now in adult heart disease. And thirdly, of course, is you need to stay active. You don't need to be a marathon runner. In fact, you just need to walk. And doing a fast-paced walk, 3 miles, 3 days a week, is a huge difference that will improve survival. Hard to know sometimes whether or not you need to see a pediatric cardiologist. We recommend that you first see your primary care physician, your family practitioner, your internist, or your pediatrician. The symptoms that we like to be referred for are anything with exercise, such as fainting with exertion, chest pain with exertion, or even palpitations. Many children who have these symptoms absolutely have nothing wrong with their heart, but these can be signs of a potential problem. Also, again, as stated in another question I posed earlier, family history. If there's a significant family history of heart disease and the child is manifesting any symptoms, they need to be cleared. Always go through your primary care physician first, but if necessary, we would be happy to see you.